everyone. It's DigiVation Startup Space once again this week. This week, we are taking a look at digital health. And here with me today is Ifeoluwa Dare-Johnson. She's the CEO and founder of Health Tracka. It's a digital health platform that allows users to schedule their tests in the comfort of their home and receive results, and it is easily accessible, of course, affordable. Hello, Ifeoluwa. Thank you for being part of the show.
Thank you for inviting me. It is my pleasure.
Ifeoluwa Dare-Johnson, who is she?
Well, that's a question with many parts, but I'm going to start this way. My background is science, right? I studied biochemistry as my first degree. And the first place I worked was a chemistry lab at UCH in Ibadan, interestingly. And at that point was when I realized very quickly the importance of diagnostics in making healthcare decisions, right? And of course, from there, I moved after graduating from school. The first place I worked in, coincidentally as well, was an health screening organization. So I remember that we used to go, from company to company then to just screen people and get them insight into their health, right? So that was my first introduction into healthcare, right? And the importance of diagnostics. Right. And then I moved into product marketing. Okay. And over the last few years, I've done marketing in tech companies, I've done in e-commerce. And then recently, about 3 years ago, I was leading medical diagnostics in Lab, right? So where because I was leading marketing, I then had to do lots of customer research, understand why people needed to do their tests, why people were not, and all of those. And then I realized very quickly that we need to educate our people. People need to realize the importance of health testing and not wait until there's an emergency. Because data was showing us that most people coming to do their tests were coming from doctor's referral. That means they already were feeling the symptoms and they needed to go into the hospital, and then the doctor says, go and test. At that point, it's almost too late. The issues are degenerating. The cost is higher because now you need to test for more things. You know how it is. It gets complicated the longer you wait, right? And then at that point, it's the chances of survival are just reduced greatly, right? So, and then it was, I left Lab not long after that. But then it was last year during the pandemic that it became obvious again with, how COVID came in and all. It then became very important that we begin to do active work to get people to do their tests early before an emergency occurs, because then we have a chance, we have a fighting chance, right? To keep people alive, to keep people healthy, and all of that. What do you gain if after you worked hard, right? And then your late 30s, early 40s, you then come down with a major illness, right? Which could have been prevented. Right. So, the money that you have chased, it doesn't make so much, it doesn't help so much at that point.
Yeah, you guess stage money is not enough.
Exactly. Right. So health, just helping people get access to testing early, it then has now become as important as possible. So yeah, that's my journey from how I stumbled into healthcare to where we are currently. We launched Health Tracka just about 5 months ago. Yeah, and here we are.
Yes. Congratulations on the launch.
And, thank you so much.
So far, so good. I've seen some of the works of Health Tracka and also your impact, how you are actually pushing through. You are quite right. People still need enlightenment. People still need access to information. But in Nigeria healthcare sector, this is one of the challenges most health professionals face.
Yeah.
Health information. So with health being the top priority, with most individuals, organizations, even countries, due to the COVID-19 pandemic, how have you been able to position Health Tracka to meet this gap in the health sector?
Yes, so as you said, the fundamental thing is to get people aware, right? So which is why our approach is to ensure that our innovation is incremental, right?
Mm-hmm.
We want to go to, I mean, of course, we want to go to Z, for example, but we want to get to B first, we want to get to C first, so that people kind of just, get it easier and find it easy to adopt, the innovation that we're coming out with, right? So the important thing for us is ensuring that testing is easily accessible. Once that is done, then the excuses reduce. Right now, if I want to do a simple, let's say, full blood count test, for example, I would probably need to go into an hospital. I probably would need to go into maybe a lab, right?
Yeah.
But if I'm right here, if I live, out a little bit outside of maybe VI and, some of the places where the major hospitals are located, the traffic in Lagos alone, and then the thought of queuing at the hospital would make me convinced that myself that I must be fine. There's nothing wrong with me, right? I'm good. It's not like I'm going to die tomorrow, right? I don't even feel anything. I just want to test. So, and these are the difficulties, right? So you then want a reason to go to the hospital. Oh, I have chest pain. Now I need to go. But at that point, chest pain can mean a number of things. Well, if you can do that even while you're not feeling anything, and which is why what we're doing for the moment is starting with Lagos. We have now created a platform where people are booking their tests. They are getting phlebotomists to come to their homes. They're taking their samples either for COVID, either for full body checkup, either for STD tests, either for domestic staff tests, either for, I want to get married. I don't even know what my genotype says. I need a package that let me know if I'm compatible with this person, right? And all of that right there, the comfort of your home, right? And you're able to do that. So that's what we're starting with at this moment, right? Of course, as I said, it's incremental. Now, as people begin to get comfortable with, I don't need to live at home, then we can then begin to add more features, right? A lot more. I mean, there's still a lot more we want to do and help people get access to a lot more tests. Yeah, definitely.
Now, with digital health labs actually on the rise due to the current health challenges the world is facing, do you think they are enough? And if they are enough, are we going to get there in Africa very soon?
I would say no, definitely not enough. So if you're in Lagos, you may feel like they're enough, right? Because again, Lagos is Lagos. But ask someone who is in a small remote town in Benin, right? It doesn't even have to be remote, right? You just not need to be the capital of, Edo State. And then ask the person how close a diagnostic lab is to you. So when you realize not very close, right? So they're definitely not enough. There may be a mirage in the major cities, but no, they're not enough. I remember, one of the reasons I'm doing this is because I saw firsthand how my own dad had to break down completely before realizing it could just have been testing. And this is, of course, it's not Lagos, but it could have been available because the more investment comes into the space, the cheaper and more affordable these tests become, the diagnostics become, and then access becomes even way more because people can afford it even better.
So what is your opinion on the current vaccination in Nigeria, the way vaccination is being handled for Nigerians? What is your opinion, and what is missing really in general in Nigeria health sector?
So, I mean, to answer the first question, I have to commend the government, right? We are a huge number of people in the country, and getting to vaccinate everyone is, I mean, it is an Herculean task, right? You can just imagine. From the point of view of education, we still have people who feel like, once you get vaccinated, there's some magnets that's going to be on your body. And then you need to spend a lot more time to educate people that it's just not possible for that to happen, right? And then you even have issue of access as well. I mean, recently I was reading that the government is now partnering with churches, right? To say, you know what, can you vaccinate people while at the church, right? Because then we can access more people, right? So I mean, that would be the only angle there to say, you know what, is there ways where private organizations can come into the play and then increase this access? That way it can be faster, right? Because again, as much as the government wants to do this all alone, they still need these private organizations because they're closer to the people, they're closer to the community. And then there would be incentive as well for, to ensure that this is done. Yeah, so in terms of what is wrong with healthcare, I would say is we need to move from reactive healthcare to preventive, right? That is the only way we can have a fighting chance to keep our citizens healthy. It is worrisome that the numbers are not good, right? There's a rise in non-communicable diseases in Africa. I mean, communicable disease, you say, okay, maybe we can't do so much about it. We just need to do interventions and non-communicable disease, but cardiovascular diseases, cancer screenings. I mean, these are things that we need to put hands on deck and do. I mean, again, you know how these things are. These diseases have no respecter of men. It doesn't matter if you are the president of a country or you are just some, it would, if it comes, right? So we need to get to the point where we can save people before they get really sick, because we don't have the infrastructure to handle a high number of people getting sick all the time. The doctor-patient ratio is still about 1 to about 4,000, right? So, which is huge. You don't want people looking for doctors, right? You want people you don't want people coming in for a month, because again, how many doctors do we have left? You all know, you've seen the news, I mean, about what's even happening with the brain drain with doctors. So who are the people who are going to treat our people, right? If the emergencies happen, right? So, which is why a lot of resources, a lot of activities and action driven and more, I mean, we're very particular about action driven campaigns as opposed to, let's just talk about it or awareness. They're great, awareness is great, but what should people do? If we say, cancer screening, and all of that, where, how, who, what exactly is the next step? Where do they get it? How is it convenient, right, for people to just go in and do their cancer screening tests, right? So I would say we need to move from reactive to preventive and begin to put hands together to ensure that we were able to delay the onset of disease for a lot of people.
Now, for Health Tracka, like you said, launched 5 months ago. And with the way you are saying that you started from neighbors, what are the future projections for Health Tracka?
Definitely, we over the next couple of months, we were expanding to other cities in Nigeria, because I mean, again, Lagos is a mirage. Fantastic to launch in Lagos and learn, so that we can then quickly rapidly expand to other cities. And then, of course, we want to go even into our neighbors as well, neighboring African countries as well. But beyond that as well, the major bit for us is ensuring that people have access to their health insights. A lot of the time, what happens is your results are scattered all over the places, right? I was just speaking to someone yesterday, and we were talking about, oh, my results. I want to do my test. I'm like, okay, when last did you do your test? Oh, I did it not long ago. So where's the results? Like, I know I never got it. It was just my doctor saw it and then told me to do okay. So now, what exactly? You can't make a conscious decision about your health, because let's say the doctor talks to you over, at that time, maybe in the next 1 month, you feel really high or up there and say, oh, I'm going to do this. But after that, because you're not looking at it, you're not saying it again, it's not with you. You don't have, the enthusiasm, the motivation is not there to sustain you enough to say, you know what, this number, let me go do another test to compare so that I know if this is getting better. Right? So one of the things we're doing, which is really important to us, is we need to empower people with their health information. Because when you have the education, you know what your numbers is saying. Yeah. If your cholesterol is high, you can make conscious decisions and say, you know what, I need to get this number to this. Is there anything I can do about it? Is it something modifiable? If it's modifiable, that means I need to watch my diet, I need to do my exercises, I need to cut off sugary foods, no more fizzy drinks. Those are conscious decisions you can begin to make. And then if you're checking it and like, I'm doing all this, it's not working, then you need to get in and see a doctor, right? Because now but you can only make those decisions when when you have your health information. So that's the way we are looking at our expansion and, building our solution for the Nigerian people.
So for these very few months that you've been on this founder CEO journey of Health Tracka, you must have encountered one or two challenges other than the general challenges Africa or Nigeria health sector is facing. What are those challenges and how have you been able to manage it for this very few short period?
So a couple of the challenges, which again, I'm not sure they're very unique to us, because again, Nigeria presents a very unique business environment. One of the things we realized very quickly is Nigeria is a very low trust environment, right? Low trust in the sense that it takes time for us to trust when somebody comes in. Like, what's their intention? Why do they need this? Why, and all of that,
why
right?
must I give my blood?
Exactly. How much blood, and all of those, right? And it is, which is where education then comes in. For us, because we're an impact-driven organization, we're a lot more invested in ensuring that we're actually, beyond the fact that we're a for-profit organization, of course, our main drive is our mission, which is we want people to have access to their health. So what we're doing about that is, so for example, we say, we're going to send a phlebotomist. When you book your test, we're going to send a phlebotomist to your house, right? And this is the time that the person is going to come. We try to ensure that at the set time, our phlebotomist is there, right? That way you can believe to say, okay, if this person came right on time, that means my results is going to come on time. So that means I can trust this company because they're delivering on their promise. So that for us, we're laser focused on delivering the brand promise, the promise that we are going to come, take your samples, get your result to you in record time, and then ensure that you can keep it and own it for a while. Right. So that's the way we're handling that challenge of low trust with education and then delivering brand promise.
Now, with technology actually invading various socioeconomic sectors, so like education, agriculture, and health, it has brought about so many tech firms, so many tech companies in Nigeria and in Africa. But policy-wise, there has been some issue recently as to how some policies from the government is affecting these SMEs. How do you think there can be a balance between the policies and the future of tech startups in Nigeria?
Yeah, it's quite unfortunate, but it always seems that the government want to play catch up at these things. And sometimes it's understandable because if the expertise is not there, you may not understand what this group of new tech guys are doing, right? And your first reaction typically should be seek to understand, right? And then be able to make an informed decision of how do we collaborate, as opposed to, oh, we need to get them, whatever that is, right? So I know that a lot of tech companies have to adjust and just make room for disruption from, the policies and all. But what I would say is that for us as a company, we are also working with the government. To ensure that, because we believe that this is win-win for both parties, right? If people have access to their health tests on time, then our hospitals will not be overrun, right? And then people can actually come in and go to their primary health care center because their cases are not emergencies. They don't need to go to the federal hospital when there's a primary health center just near them, because it is not an emergency, right? Again, so these are ways where collaboration needs to be the word, right? But again, collaboration requires willingness from both parties, from both parties, right? Where the government needs to see the tech companies as enablers, as people they can partner with, not as a threat, right? But as what can we do with these people? And that's where, collaboration and being diplomatic and just willing to work with each other needs to come in.
Thank you very much, Ifeoluwa Dare-Johnson.
This is my pleasure.
It's a pleasure having you on DigiVation Startup this week. So guys, check out Health Tracka, book your tests. So Ifeoluwa, thank you for being part of
my pleasure. It is my pleasure. Thank you for having me. Bye.
Bye.
This is DigiVation Network.